Hey, good evening, everybody. Thanks for taking some time out to join us. My name is Amber Miller. I'm the Rapid Response Director for our unions program. For those not familiar with it, Rapid Response is the USW's nonpartisan grassroots education, communication, and legislative engagement program. So we wanted to give everyone some updates on what we know right now concerning the legislative changes and laws that impact all of us during the pandemic. We know it's been a tough ride for everybody, with nearly all the states in the country under shelter-in-place directives, and so many of our members still working not only on the front lines in healthcare, but also in workplaces deemed essential. We've kind of been left with a lot of questions and concerns. So we're hoping we can shed some light on those this evening. It's important to note that these are US-based changes, so these don't affect our steelworker siblings in Canada. And if you have any questions while we're moving through this conversation, please ask them on the Steelworker Facebook Messenger, and we'll do our best to get to those as we go along. So we want to extend a huge thank you to all of our members for what they're doing through this crisis. You know, whether it's working from home to do their part to keep our communities safe, saving lives while they risk their own in healthcare facilities, dealing with conditions that are inadequate to say the least, or folks in workplaces who continue to work under uncertain conditions to keep a country supplied and moving through the crisis. You're so appreciated. We're all privileged to represent you, and our nation is grateful. So I'm joined this evening with our Legislative Director, Roy Hausman, and our Director of State and Regulatory Policy, Anna Fenley.
Hi.
And so both Roy and Anna are working really hard with our union's leadership to push for protections and assistance to our members at the federal and state level during the crisis. They're going to help us walk through some of the recent changes in the law and kind of what we hope to see in future legislative measures. So Roy, can you give us a little overview about what's happened so far?
Yeah, sure. Thanks, Amber. And it's really great to be on here, and thanks for this opportunity to kind of chat with everyone. You know, so it's important to kind of see where we're at. You know, as of April 13th, the world's seen over 1.9 million cases of the coronavirus and over 118,000 deaths. In the U.S., there was, you know, almost 570,000 cases, a little over 570,000 cases confirmed, and 23,000 people have passed since the coronavirus first started in the U.S. alone. This pandemic moved really quickly, and for institutions not known for speed, like Congress, for example, this rapid moving pandemic really forced some major actions very quickly. But looking back, it seems like it was kind of this slow train, really. Like the first US person that was diagnosed with coronavirus was on January 20th in the US. And then 2 days later, the city of Wuhan in China was the first major city, population area to really get locked down. They were cut off from the rest of the country, and that was the first radical attempt to mass quarantining in the modern era. France, almost 3.5 weeks later, had their first death on February 14th. And then the first time the Trump administration formally asked Congress for any funds to fight the coronavirus was 10 days later after that first death in France in February 14th. So on February 24th, the first time that was any real administrative action on the coronavirus, their initial ask was for $1.25 billion. And 2 weeks later, the first Congress passed their first bill, and then there was this rapid fire of legislating afterwards. So there's been 3 major packages passed by Congress so far, and signed by the president since the pandemic took hold of the country. And 3 of those bills are the Coronavirus Preparedness and Response Supplemental Appropriations Act, which was passed on the 6th of March, the Families First Corona Response Act, which was on the 18th, and then the Corona Aid, Relief, and Economic Security Act, or the CARES Act, which was passed on the 27th. And so we're going to talk about these three bills in more detail. But meanwhile, meanwhile, it's important to kind of think about the economic and human impact of the virus, and how it's been felt very acutely by our members and lots of working people around us. More than 17 million people have filed for unemployment insurance benefits in the past 4 weeks. And it really is quite a devastating impact that's happening economically and quite personally for a lot of workers. So yeah, so those are just a rundown on the three bills so far, and it's fun to I'm looking forward to talking about it.
Yeah, thanks, Roy. Can you tell us a little more about the first bill? It seems like this one was mostly just to give money to help different agencies within the government and not.
Sure. So the Coronavirus Preparedness and Response Supplemental Appropriations Act, which is really a mouthful, it was $8.3 billion. So, the Trump administration's first request was 1.25, and then about a week later, they asked for 2.5 billion, and Congress, realizing that there was more need than that, in the initial start, they put in $8.3 billion. And really, there was more than 1/3 of those funds went to support vaccine research and development. And so just to give you a sense of some of those top lines, the Health and Human Services Department had 6.47 of that $8.3 billion. And broken down into that as various agencies, including the CDC, which got 2.2, and they got federal funding for state, local, and public health agencies. The Public Health and Social Service Emergency Fund received 3.1 billion to help procure medical supplies, research and development of vaccines. And then the National Institute of Health, for example, received almost $1 billion, around 830 million, for research and development on vaccines and therapeutic items. And then finally, this is really an interesting piece as well, that is that they had an emergency telehealth waiver for those that have Medicare. Telehealth restrictions during the coronavirus public health emergency have been lifted primarily on a lot of things. So Medicare providers to furnish telehealth services to Medicare beneficiaries, regardless of whether the beneficiary is in a rural community, because there was some law before then allowed some telehealth in rural, but not in everywhere. And now this opened it up to a much broader audience.
Yeah, okay, those things make a lot of sense in terms of, making sure these agencies have the resources to effectively operate during the pandemic and fund a response. So does the next bill do a little more to support working families who are impacted?
Yeah, so unlike the first bill, the second bill, the Families First Corona Response Act became a more serious effort to aid workers as the number of cases globally increased. They increased to over 191,000 cases with close to 8,000 deaths at that time. So we think about that in early March. The bill passed very quickly with a large bipartisan majority. 40 members voted against the bill. They were all Republicans, and one independent, a MASH out of Michigan, voted present. But the bill was significantly higher spending by Congress, with roughly $192 billion in some other subdivisions. And yeah.
Thanks, Roy. So Anna, can you maybe pull some pieces out of the legislation that might be most meaningful to our members?
Yeah, Amber, I'm happy to, and thanks everyone. It's nice to be talking to people. So thanks for tuning in. So that second bill, the Families First Coronavirus Response Act, there are really just a few key pieces to pull out that we should talk about. The first one is free coronavirus testing. So in that bill, Congress said that private health plans, so the plans that we negotiate with our employers for, must provide coverage for the COVID-19 diagnostic test, including the cost of the visit or any other cost kind of associated with making sure that folks can get that test. The second piece that's really important to highlight is that the federal government recognized that many people would be applying for unemployment insurance in the coming weeks and months. So this was remember, this was like before most states went under emergency orders. But they recognized this was going to happen. And the unemployment insurance system, or the UI system, is kind of a federal state collaboration where the federal government provides some of the money, but each state really operates their own program and has their own rules. So we'll talk a little bit more about unemployment insurance later, but the point here is that in this second bill, Congress recognized that states were going to get a lot of claims, and states are currently at historically low levels of funding to administer the programs. And administering the programs basically means processing claims and getting checks out the door. So in the Families First Act, Congress allocated $1 billion to go out to states to help them staff up and get ready for the influx of claims. I know that some people are having trouble with this, with their state unemployment offices still. They just were not prepared, but hopefully some of this money helped. And then the third and kind of most impactful part of the bill for working families is that it called for paid sick leave just for the coronavirus. So that started on April 1st and extends through the end of the year, so through December 31st.
Okay. Well, I'm really glad you mentioned that, Anna. So under this provision, what happens if I have to take time off if I'm exposed to the virus, or I have to stay home and take care of my kids whose schools might have closed because of the different stay-at-home orders?
Yeah, so it's a little bit complex, of course. So for full-time employees, the bill requires that employers provide 80 hours of paid sick leave. So if you're working 8-hour days in a week, that would give a person 2 weeks of paid leave, basically. And that was to follow the guidance that if you were sick, you needed to stay home for 14 days. So there are a few ways someone can take this leave. Mostly it's if someone is quarantined or isolated by the government or advised by a healthcare provider to self-quarantine. It's also for someone who's experiencing symptoms and is waiting for a diagnosis, so waiting for test results to come back. But as you mentioned, Amber, it's also if someone is caring for someone else who's sick and quarantined, or if someone's caring for a child whose school or daycare is closed due to the coronavirus. So those first reasons, basically, if you're sick or you think you're sick, you're eligible for 100% of your pay. For the second two, if you're caring for someone who's sick or caring for a child, then you're eligible for 2/3 of your pay. And the other thing that they did in this bill was to expand the FMLA so that someone who's caring for a child gets 10 more weeks of 2/3 of their pay for a total of 12 weeks of paid leave to help care for a child whose school is closed.
Gotcha. Yeah, that's great. Obviously as a union, we've always fought for paid sick days for a long time, but this doesn't cover everyone, right? We have a lot of folks that seem like they are excluded because they work for either a really small employer or an employer with over 500, or they work in healthcare. Like, where does that leave them on this?
Yeah, so it's a good thing to raise. Unfortunately, the bill exempted some really big groups of workers. So healthcare providers and first responders are not covered. And it's important to say that Congress just said healthcare providers and first responders could be exempt, but the Department of Labor got to define who counts as a healthcare provider or a first responder. And the way the Department of Labor defined that was basically anyone who is an employee or an independent contractor working for a healthcare facility or doing kind of first responder type activities. So Congress said that it excluded these workers, and we contested that all along, and are fighting to fix that. It also exempted workers at companies with more than 500 employees in the U.S. And I know that that's a lot of steelworker companies. And many of these companies provide some paid sick leave, but 2 weeks is what's needed for COVID-19 recovery, and that's not really the normal amount that most large employers provide. And the reasoning that Congress excluded them was that this part of the bill includes a tax credit for employers to use to help pay workers for that paid sick leave. And both Democrats and Republicans said that large corporations should not be eligible for that tax credit for something that they should already be doing. So, we as a union recognize that this is a huge issue, though. So our district directors all across the country have sent letters to the elected leadership and governors in nearly every state asking them to close these loopholes. And, we're working to get some bills introduced to try to fix this problem. But this is all of these exemptions, healthcare workers, first responders, large employers, these are huge issues.
Yeah, I'm really glad you brought that up, Anna. Actually, Rapid Response is sending out info alerts to each one of the states that have links to these letters that the district director sent. So folks know that we're working towards this. It's always been a goal to make sure every employee is covered. Our hope is that we can pressure these governors and state legislators to do the right thing and make sure that everybody gets covered. So Roy, there's another bill that you mentioned earlier, the CARES Act. Can you help us understand pieces of that?
Yeah, sure. Thanks. So the Coronavirus Aid, Relief, and Economic Security Act, it's an acronym called CARES Act. This bill is, by comparison to the first two, was one of the most dramatic amounts of congressional spending ever for a non-wartime effort. At this point, infections globally had increased to over 300,000, more reported from just the 2 weeks prior, with 509,000 confirmed cases and 23,000 deaths globally. And in the US at the time, only 68,000 confirmed cases and 991 deaths. So this bill, though, realizing how this curve was kind of coming up, as you've kind of seen in a lot of the news articles, this bill authorized over $2 trillion in relief into the economy, combined with the ability for the Federal Reserve to take on corporate debt. It is likely that the true amount of spending will be over $5 trillion. To give perspective on the overall economy, produces roughly around $20 trillion in monetary value of all the finished goods, every item that a steelworker makes or helps or produce and manufactures, to the services that are provided. That total economic wealth is considered about 20 trillion in a given year, and that's how much, we're the largest economy in the world. Congress just authorized roughly somewhere between a tenth and a fifth of spending to prop up the economy.
Wow, that's a lot of money. Anna, can you walk us through some of the provisions in this bill that would be helpful to members and their families?
Sure. So one of the major provisions in this third bill is a huge expansion of the unemployment insurance system, or UI, which is, as I mentioned earlier, Congress knew before that there was going to be a huge need here. And there has been, right? Over the last few weeks, 11% of the American workforce has applied for UI, and we expect that number to grow. So as I mentioned earlier, UI is administered in each state. So each state has a slightly different process for filing a claim and a different length of time for starting to receive benefits. So I've heard that some laid off steelworker members in New York are already receiving their full benefits, but steelworker members working at the same company in Tennessee who are, laid off at the same time are not yet, because Tennessee is just slower in processing. So it's going to be different all across the country.
Man, that seems super complicated. And I know a lot of our members, they have never been unemployed, so they've, never had to really navigate this system. Is there, if someone did get laid off, is there, someone they could go for specific state information to see what they're eligible for and how to apply?
Yeah, and it's definitely confusing. I mean, I can speak personally. I know that I have 4 people in my family who have been laid off, and I'm trying to help them navigate the system in a couple different states. So one of the helpful resources that I've used is the AFL-CIO has developed a really good state-by-state resource that might be helpful if you or a family member need to apply for UI in your state. You can just click on the links and bring up your state, and there'll be a couple different links for resources specific to where you live. So that's kind of the specific stuff for your state. Generally, though, we can talk about some of the things that have happened across the country. So some states normally have a waiting week or waiting weeks, so you have to generally wait before you start receiving benefits. And some states normally have a job search requirement, so you have to be actively looking for a job to receive benefits. And most states during this time have gotten rid of those requirements. I mean, obviously it doesn't make sense to require someone to be looking for a job when there are no jobs and most workplaces are closed. So the other thing is, traditionally, UI benefits were only available to employees. It was a sort of a narrow group. But the CARES Act that Congress passed expands access to part-time workers, to people who are self-employed or who are contract workers. It expands it to gig workers like Uber and Lyft drivers, and others who aren't normally able to get UI. So workers in most states are eligible for 26 weeks of benefits from their regular state-funded unemployment compensation program. A few states have a slightly lower number of weeks, and one has more. But the CARES Act actually expanded that, and so the federal government is going to pay for an additional 13 weeks of benefits for everyone who uses up their state benefits. So for most people, that will be, just over 9 months of benefits, which is really helpful. And then on top of that, until July 31st, everyone receiving UI benefits will get an additional $600 per week on top of their state benefit.
Gotcha. So, Anna, does that mean it's a flat 600, or is it like 600 up to my full wage? And I'm going to hold you off there too, because it looks like Connie has a question from some of the folks that are listening.
Hi, everyone. It's Connie from the New Media Department. Welcome. Thank you for joining us tonight, and thanks for all your questions. We're going to try to get to as many of them as we can this evening. If we don't get to your specific question, don't worry. We will get back in touch with you specifically, maybe offline. We're also kind of joining, a lot of you have the same questions, so we're going to lump them together, like this next one about unemployment, since you're talking about that. AJ Knight from Local 1055L, as well as Brian Smith from AK Steel, and Richard Romo from 8599. They all have questions about this unemployment benefit. They want to know, unfortunately, they've been furloughed or laid off. They want to know, how do they get that extra $600 in benefits? And if you have any advice about how to find out when that might be, when they might be eligible for that. Does it matter when they were laid off?
Great, that's really good questions. And I'm sorry to hear that you guys are laid off. So each state is administering their own program, as I mentioned, and each state provides a different amount of benefits. So the average across the country was about $387 nationwide per week. But that ranges from like a low of $215 in Mississippi to, I think, a high of about $550 in Massachusetts. And so no matter what your state benefit level is, this would just be $600 on top of that each week. And the reason that Congress did it that way was because, as we talked about before, they knew that people needed more money, but they also knew that states were not prepared for, all of this administrative work for these huge numbers of claims. So they just said, let's make it easy and top up everyone's check by $600 a week. So that goes from April 1st through the end of July. And there's nothing that you have to do to request that or do anything different rather than just apply for UI benefits in your state. The thing that we have heard though is that, and this is just anecdotally, some states are already paying that extra $600 per week benefit out. Some states are going to have to kind of back pay that $600 extra. So if you're not getting it right now and you're getting an unemployment insurance check, you might get that back kind of in a lump sum once the state is able to administer the program.
Great, thanks, Anna. We want to remind everyone, if you have a question about your specific circumstance, you want to reach out to your local union or to your staff representative at your district office. You can find that contact information on our website, usw.org. Click on the districts tab, and there you'll find a contact tab for every district in the union. There's a map, so you can find out which office is closest to you. So I'm going to go hop back off and look for more questions. I'll see you all soon.
All right, thanks, Connie. So Anna, it seems crazy that every state has such drastic differences in their benefits. That's crazy. So I know there was also a provision that would send stimulus checks to most Americans. Rory, can you tell us a little bit about who would get those?
Sure. This was added into the CARES Act and included a sizable, what they were calling a recovery rebates of $1,200 per adult, $2,400 for a married couple, and $500 per dependent child aged 16 and younger. So a married couple with 2 children is therefore eligible for about $3,400. The rebates phase down gradually for couples with incomes over $150,000 and heads of households with incomes above $112,000 a year, and individuals with incomes above $75,000. So it phases down, so you'll get that recovery rebate will adjust depending on your annual income, and these rebates but the inverse is the rebates are significantly larger than the 2008 stimulus plan. And unlike the 2008 stimulus plan, they don't require households to have a minimum level of income to qualify. These sorts of direct stimulus payments are significantly more useful to the economy than what has been tried and what has been kind of pitched by some in the administration and others as a payroll tax holiday. This would cut the payroll tax used to pay for Social Security and give you that money right away, in your check in theory. But the problem here is that it gives more of a break to wealthy people than everyone. About 2/3 of the benefit of the payroll tax cut would go to the richest 20% of Americans. Also, the payroll tax has long-term implications to Social Security. But that actually reminds me of another piece, is that originally the administration, when the law was passed, they were going to require anyone that was collecting Social Security, so for our retirees out there, they were going to require them to file a tax filing in order to get that rebate, which unlike 10 years ago during the Great Recession, you didn't have to do that tax filing. They made a change through guidance. And we were gearing up to get active on this because it was just totally unfair for seniors who are really, at the worst time, and for an illness that really impacts seniors significantly. And very quickly, actually, as soon as a couple articles came out, the administration changed tact and quickly allowed, so you don't have to file a tax form if you're collecting Social Security. So that's the more or less of the $1,200 payment.
Okay, well, that should definitely give some relief, but I know there's still a lot of families that are going to struggle to make ends meet during this. Is there anything else in the bill that's helpful to them?
Yeah, the CARES Act also included just some pieces to help working families make it day to day with some of their household finances and the debt that a lot of families have to carry. So one of the big pieces is help for people who have federal student loans. And this is only applicable for direct federal loans issued and held by the government, and it doesn't apply to private student loans. But over the next 6 months, so from April 1st through the end of September, federal student loan payments will be automatically suspended. So these payments should be automatically suspended. That's what the text of the law says. But anyone who's counting on this probably wants to check with their loan servicer just to make sure. And during those 6 months, interest is not going to accrue on these loans, and all 6 months of that suspension will count as monthly payments for both loan forgiveness programs and loan rehabilitation programs that anyone might be in. And then there are some other provisions to help people with mortgages and prevent foreclosures. So there are provisions for folks with federally backed mortgages and provisions to prevent evictions from tenants who live in federally subsidized housing. And then individual homeowners can go to their loan servicer to request a mortgage forbearance for 180 days with their servicer for hardship related to the coronavirus emergency. And I know that a number of steelworkers may have Union Plus loans. I know that the Union Plus program is doing some of this and helping with that, and there's some of that information on the USW webpage. And then the last piece is around credit reporting. So between the end of January, so kind of retroactive, until 120 days after the end of the national emergency, creditors cannot report borrowers as late if they worked with them on accommodating them for some kind of hardship reason. So in other words, if you call your if you're going to have trouble making payments and you call your servicer to get a hardship accommodation, like a deferral or a forbearance for some economic challenges during this time, the creditor has to report your account as current for up to 6 months after the national emergency ends. So that can be really helpful for people so that this situation doesn't just completely ruin their credit.
Yeah, thanks for that, Anna. Hopefully some of this stuff will at least help families get through things right now. And I'm going to hold off for a second. It looks like Connie has another question. I'm going to let her pop in here.
Hey, thanks everyone. It's kind of related to families dealing with hardship. We have a lot of folks who are writing questions about leave, FMLA, sick leave, wanting to know which kinds of leave they can get. Are they getting paid for that leave? Do you have any advice for those members who have questions about FMLA or other kinds of leave?
So I was playing chicken here.
Yeah.
As we talked about earlier, the Families First Act, which was the second bill that Congress passed, is the bill that dealt with leave. So there's some information on the Steelworkers webpage that details some of this information that we've talked about, but there is that requirement for paid sick leave for 80 hours for folks. And then there are some plus ups for FMLA. I don't know about people's particular circumstances, and there are a number of employers that were exempted, as we talked about, but I would point folks to the webpage, and you can find some of that written information, or maybe when this video is posted, kind of rewind and go back and also reach out to your local union.
Right, and your staff rep. And I also want to put in a plug for our Education and Membership Development Department has been doing a series of educational webinars about the CARES Act, particularly how it relates to leave. And I know there's one coming tomorrow, preview for those of you tuning in live. There's a new one coming tomorrow that's specifically about FMLA. So check out the Facebook page tomorrow. It's a really informative webinar, and it may answer some of your questions. Our great educators put that one together. All right, I'm gonna hop back off. I'll be back soon.
Great, thanks, Connie. All right, so Roy, how about things on the business end? We've seen our community shut down, a lot of the small businesses closed. That has a huge impact on, folks who worked in them. is there help for those places to still be able to make their payroll like during all this?
Yeah, so one of the big pieces of the CARES Act, another major component was assistance for small businesses and large corporations. In fact, most of the money that's being produced is primarily focused towards the business, both small and large. And the first big program on the small business side, run through the Small Business Administration, is the $349 billion loan program for small businesses, 501c3s, and physician practices. It's commonly known as the Paycheck Protection Program. The loan will be fully forgiven if the funds are used for payroll costs, interest on mortgages, rent, and utilities. But as of right now, due to the high subscription rate, at least 75% of any of the forgiven amount must be used for payroll. Loan payments will also be deferred for 6 months. So no collateral or personal guarantees are required. Neither the government nor lenders will charge small businesses any fees either. So it's the small business side is definitely getting a lot of interest from a lot of our smaller employers. We've heard a lot of people kind of flocking to apply for that.
Okay, well, that's good news. What about the bigger businesses? I know that previously, in these bailouts, they've, kind of used the money to offshore jobs. They ended up buying back stocks. Are there provisions to keep them from doing that now? I also heard there's a little organizing piece in there potentially, but there's some news on that.
Yeah, so this is the big kahuna here, right? Is that there's another roughly $500 million or $500 billion, B with a B, that was designed as basically money to give to the Federal Reserve, and then the Federal Reserve is going to use that to help create certain direct loans to the banks that then support out the various companies. And so, there were included in the bill a number of provisions that were inserted to try and protect taxpayers and emergency relief. So, the large businesses provisions, besides direct aid for the air carriers, for firms like Boeing, those kinds of things, they're going to do this sorts of investment. But then, so the Federal Reserve targeted these specifically at nonprofit and organizations of businesses, roughly 500 to 10,000 employees. And then they had some additional criteria for obligations of the recipients. So the funds must be used to retain at least 90% of the recipient's workforce with full compensation through September 30th. The recipient, and then there were some other provisions that were in here, such as no outsourcing or offshoring of jobs during the term of the loan, plus 2 years, which sounds really good, right? They won't, and whoever receives these loans will not abrogate existing collective bargaining agreements for the term of the loan. And that this was something that piqued a lot of interest, was this idea that the recipients will remain neutral in any union organizing drive for the term of the loan. So those provisions right there, we were very, diving in, kind of learning more. And something that we've just found out is that Treasury and the Federal Reserve issued guidance, basically, that how they're going to issue these loans, is that more or less the law, the way it was written, is while it's explicitly in the text of the bill, right below the bill, it says, right below that text, it says a little item that says, under these Treasury and the Treasury Department and the Federal Reserve have the right to change the terms, basically, is more or less. And so all of these provisions that we were expecting on outsourcing, on union neutrality for organizing, and the collective bargaining provisions, while we thought they were there, the way they're implementing the law, or the administration is choosing to implement the law, I should be quite clear on this, because this is a Treasury Department, which is very much administered by the administration, have chosen to not use those provisions. And so none of the loans contain guarantees on any of the provisions we just talked about. There are some provisions that are larger that regarding stock buybacks and limits on executive compensation, but it's really frustrating because we felt like we'd done a lot of good work to try and put some additional conditions on these big pots of money for big companies, and now we're kind of back at it again.
Yeah, it seems like through all of this, as we've tried to, and with both of your help, tried to figure these bills out, we've had to look at the Department of Labor's guidance, the guidance from, the Treasury Department, and doesn't seem like it's been necessarily, in our favor. And so that I can see how that can be really frustrating to see all this. But, hopefully they use these provisions the right way and it helps, keep these businesses on their feet. I'm also wondering a little bit about our public services. So our schools, they're operating completely differently right now. All the kids are at home and they're still having to provide that service. There's different circumstances, around our public transit systems. They're really being impacted right now because the tax revenue is lower. So there's not, the money to keep those things running. Is there anything in place to make up that revenue so we can, keep our communities going?
Yeah, Amber, there is. This was another big piece of the bill, and I'm laughing to myself a little bit because, as Roy said, this is a $2 trillion bill. It's just huge. It's almost like we're talking about funny money. But the Congress allocated $150 billion to state and local governments to help them pay for the COVID response. Obviously those governments are bearing the brunt of kind of the day-to-day response. And, as we kind of look forward, they're going to need even more money because of all of the lost tax revenue that they're experiencing now and that they will as this recession continues. The bill also included money to go to schools to help them teach in these new circumstances. Obviously, that's really important. Also money for public transit systems to disinfect and continue limited operations while they're not collecting the same amount of fares. I know Roy and I live here in Washington, D.C., and in a city like ours, public transit system is still really important for lots of workers to get to work. And then the other piece that I think is really important in this bill was around election security. And obviously this is a really important year. It's a presidential election year, and many states are having primary elections during this period of time. So since we still don't know how long the virus is going to last and what November is going to look like, Congress started allocating a little bit of money to states to basically ensure that our democracy can still function. So anyone who is paying attention saw the chaos and fear around voting that just happened in Wisconsin and some of the problems with vote by mail there. And I think everyone wants to make sure that other upcoming election days go more smoothly. So this bill had $400 million in grants that are going to go out to states to increase voting by mail, early voting, online registration, and the safety of in-person voting for the 2020 election. So that's a really key piece.
Yeah. Well, thanks to you both for breaking down those bills for us. It's a lot of information to digest, but it's we all know it's important. I have to say, though, it seems like there's some things missing. I know Rapid Response and our union in general has worked a ton on protecting pensions. I don't see anything in any of the previous bills on that, that we talked about. That's just one example. I know there's more that they're working towards, and I think maybe Connie might have a couple of more questions here on some things we're kind of looking forward to working on.
Yeah, lots of questions. The $1 million question comes from a lot of our members who are being deemed essential. And as we know, they're still working every day, being our heroes. They want to know about hazard pay and what do we know about hazard pay and what do we have to look forward to regarding hazard pay?
So on hazard pay, this is an ongoing discussion point that you know, we think that our members and any worker who's putting themselves out there, should be able to work safely. That's the key piece here. We should be eliminating the hazard, but since the risk is there, we should be making these sorts of efforts to ensure compensation, that these workers are fairly compensated for this risk. When 1 in 5 people who are exposed to the virus can have serious health illnesses, we really need to make sure that we do everything we can for all of those workers. Democrats in the Senate, Senator Schumer, Minority Leader Schumer from New York has proposed a hazard pay basically of $25,000. It has been one of those items that's kind of been talked about in future packages, but at this point, they haven't been able to move forward on it. But it is something that we've been working closely on to make sure, first of all, we just eliminate the hazards as best as possible and get people the right PPE and other things, but then to ensure fair compensation for the risks that people are taking.
Thank you, Roy. There's a couple other questions as well, particularly about safety. We had a question from Brother James Campbell. He wants you to discuss, if you can, OSHA standards, particularly some things that are being, as he says, rolled back. The Secretary of Labor is walking back some OSHA standards regarding recordables. So do you have any insight about that?
So I think we've been pretty, just overall, we've been pretty disappointed in OSHA's response here. We, generally speaking, I don't know the specific answer about OSHA recordables. That's not something that I have heard in particular, but we've definitely been working on to call out the administration, to call out OSHA for not doing enough to protect workers. So one of the things that the union did was a little over a month ago, knew this was coming, so we joined with a bunch of unions and sent a formal petition to the administration to call on them to finalize an emergency temporary OSHA standard to protect people who still have to work during this time. And the reason we wanted a standard was because it would be enforceable and you would have to prove that you were taking measures to use engineering controls and administrative controls and PPE to protect anyone who's still at work. The Trump administration and the Department of Labor they could just do this, right? They could put this standard in place, but so far they're not. And we've been talking to them over the last however many number of weeks, and they are not doing that. They have today made some announcements about possibly doing some more limited enforcement, but it seemed a little bit unclear on how those decisions would be made. So one of the things that we're doing is also pushing for Congress to include mandatory protections and mandatory enforcement by OSHA in legislation so that they have to do this and protect workers.
Thank you. And along those lines, regarding safety is PPE. Lots of questions about PPE. A couple questions about, we know there are shortages in some areas. Some members like Chris Brewer are asking, how can they help? Where can they donate PPE? Do you have any insight on that?
Amber, do you want to take this one?
Yeah, Amber.
Go ahead.
You go ahead, Amber.
Well, I was just saying, Connie, there's a place on the website, I believe, on the USW COVID resource page that I think they can be able to ask some of those questions, and maybe we can direct them to the right place. I would probably say look locally about what your local can do. If you're in a place where you can donate those things, look around your community to see who needs help. Reach out to your staff or your district director to be able to find those places that are hurting. I know we all know that PPE has been a huge issue here, and I know there's some legislative things happening Roy, on a federal level that we're, looking at to see where we can get help to folks.
And that the website that Amber mentioned, usw.org/COVID-19, there are lots of resources there, including there's a link there about PPE, how you can work with your employers or your local unions to get PPE donated or match it to where it needs to go. There also is on that website, for those of you who are reporting issues with needing PPE, there's a form on that website to report health and safety issues at work. And if you fill out that form, we deal with those every day. We help get those to our district offices, to the staff, and to our health and safety department, so we can address your specific needs through that form there. I think that's all I have for now. I'm going to hop back off and see if we have time for a few more. Thanks, guys.
Okay. So Roy, I know there are some other things that are kind of on our wish list going forward. Would you mind touching on a couple of those?
Yeah, okay. So, I think as, the need is still really great out there. I mean, really, you have to kind of think about one of the things that we've continued to kind of press on Congress and others on is a few kind of key items right now that are really related to the union that will help ensure long-term sustainability for a number of items, but also like encourage better health outcomes for a lot of our members and people generally. But number one, this is such a key issue is pensions. The fact that we've passed over $2.5 trillion in spending for businesses, and a good part of that for businesses. And we have yet to incorporate a simple fix for pensioners. The multi-employer pension system, for example, there's about 1 million participants who receive a monthly check that they worked for decades on, and their plans are underfunded. And this COVID crisis really impacted the market, and that's going to impact our ability for those plans to be sustainable over the long term. And so, for those people, like seeing bailouts of the airline industry and bailouts of all of these other industries, like when we're talking about, I give this example quite a bit, where if you had a penny right now, you have $1 million. If you had $10, you're a billionaire, and if you have $10,000, you're a trillionaire. If you were to scale it down, right? Now this the issues with the pensions, we're looking at somewhere between $60 to $100 billion in aid that for these plans to help protect over 1 million people and also sustain an entire system of about 10 million participants in the multi-employer pension system. So it's going to be something that we're going to be pressing for, and we know that there was some proposals in the CARES Act that got stripped out at the last minute, unfortunately, because of actions by some senators. And so but we know that there's an alignment here that we're going to try and work very hard on this, because it would be absolutely a shame that if we've had 2 recessions now where they haven't done anything to help protect pensioners, and it would be absolutely insane that if they didn't do it this time now. Other items that we're caring about is like healthcare, like simple, the healthcare you need. Like if you've been laid off, you get that COBRA benefit notice, but that COBRA benefit is like a significant cost to any individual. And if you're even with that $600 pandemic unemployment assistance, it's really not enough to cover the full cost of any sort of COBRA premiums. And so for us, like that's one of the key things that we want to try. We've been pushing Congress on right now is this idea that, COBRA premiums need to be covered for this period of time while we try to ensure workers have the health care that they need. Because the last thing we want is people getting sick and not going to the services to get the services that they need, particularly if they have COVID. This is kind of also the same thing with like first dollar coverage if you're sick with COVID-19. Like, the last thing we want to have happen is clusters or more people get sick because they didn't choose, because they were afraid of their deductibles, afraid of how much it was going to cost them out of pocket. And so these sorts of things we're pushing Congress on, and then finally, one of the things that we're really working on as well, or another item that I should say that's been really important for a lot of our manufacturing members, is tariff defense. There was an effort by some trade associations like the National Retail Federation to exempt tariffs or delay them during this crisis. It's a really dangerous tactic. As we've seen in previous recessions, there's a significant increase of dumped and subsidized products that enter the country. And just to give you one good example, in China, while their country shut down, a lot of their steel mills did not shut down right away. And so right now, it's been reported that over 100 million tons of semi-finished and finished steel rest on the ground in China right now. So that's the equivalent of one total year of US production. And that's just sitting, that's product that isn't being used and is going to enter the global market at some point. And it's going to, if we don't work through this the right way and we don't have basic protections for our domestic industries, we could see longer term job loss in the manufacturing sector. And that's why, things like tariffs are one good step, but then the next big step there is to have good infrastructure bills as well. So it's, again, something that's been kind of put to the side right now as Congress tries to deal with the fact that we have over 500,000 people here in the US who've tested positive for COVID and a significant amount of death and all of that. But in the future, as we come out of this, this significant recession, we're going to need the sort of large infrastructure investment that we've done in after previous recessions.
Right.
And so, just to kind of give a sense, I'm sorry, I kind of jumped in a little bit on a few different items here, but for the last 2 weeks, well, 3 weeks now, there's been this ongoing negotiations over another package. And it was originally like I mentioned, we were going to have this broader piece with infrastructure, try and incorporate other healthcare things, a large piece for like, Democrats had proposed some large stuff for election security and ensure workers, and people could vote. And all of this has been kind of just bottled up as Congress, as of today, has indicated that they aren't coming back until May 4th. And so at the minimum. And so there's a possibility of another package that could provide some additional funds for small businesses and some additional funds for hospitals and workers that's been kind of kicked around right now. But these larger things that are going to be needed for the economy and larger pieces for like pensioners and others that just haven't quite made it in yet. And so we've really got to engage on it.
Yeah, thanks, Roy. I know that you and Anna are working really hard to make sure these additions are, at the forefront in priority to our members. I'm grateful that our union is continuing to push for those when we didn't get them in the first trio of bills. So, what about health and safety improvements? We had a couple of questions about that earlier. Our members are particularly, those who are still working in these essential workplaces, they're in a very precarious situation here. Are we working for any changes to protect them? I know, Anna, you covered just a little bit of this before.
Yeah, I covered a lot of it before. And of course, Roy and I are on here tonight just talking about kind of the policy stuff that we're doing. Of course, there's a lot of stuff that local unions and staff out across the country are doing in bargaining. So in addition to kind of trying to get OSHA to fully enforce the standard to protect workers, we're also advocating for fuller use of the Defense Production Act to make sure that frontline workers, essential workers, everyone who's out there has the PPE and the equipment that they need. So, I don't know, Roy, if you want to talk a little bit more about the Defense Production Act, kind of what that is, that might be helpful.
Yeah, so the Defense Production Act, it was enacted around the Korean War. It was designed to ensure the U.S. had enough supplies for its defense. Interestingly enough, it helped build the country's aluminum and titanium industries, which are, still a good number represented by USW members. It was really interesting. I was doing research and seeing discussion about Alcoa facilities in Tennessee and in other locations where I was like, oh, our members still work there or have worked there. And so, but, this older law can still is actually used quite a bit. FEMA routinely uses it in responding to hurricanes and floods. And basically, under the DPA, agency officials can negotiate with manufacturers, immediately decide who will produce a product. Like let's say face masks, for example, and at what price. And had the Department of Health and Human Services used this in the act last month when it decided to buy about 500 million protective masks, some of these masks would have already been delivered to health personnel and manufacturers, and it could have been, they could have been making more. And so, the DPA basically allows the Defense Production Act, sorry, in DC we use a lot of acronyms, so we take longer words and make them very short. And so the DPA, Defense Production Act, also allows a government to basically move to the front of the line. So if there's a set of orders out there, the federal government gets to say, well, we're going to move to the front of the line, get our orders first, so that we can then distribute those orders in an efficient and effective manner. And so, that's something that we've been pushing the administration to do. And there've been like pieces here and there, but there hasn't been this really like concerted effort on the very important items that we really need, like ventilators, face masks, and these kinds of items. So there's been states competing against each other, and stories of like, we've heard stories about hospitals in Michigan paying $8.50 for the face masks when they normally only cost like 50 cents to $1 to produce. And so, this is another reason why we think very strongly that the DPA should be enacted. And the other thing that's really important about this is that the government can also then provide loans and other things to help basically expand production with new products or new plant capacity. And then one of the things that they can do is then use that to adequately stockpile supplies later on as well. And they've done it in the past with exotic metals, ammunition, and other items as well. So.
Thanks, Roy. While we're waiting on that, we know there's lots of companies and individuals stepping up and donating or making PPE. And I just wanted to take a second to highlight some of those. We have members at Mississippi Polymers in Corinth, Mississippi. They've switched their operations over to make paper medical gowns. Local 525U at Batesville, Indiana's Hill Room are working overtime to produce ICU beds and ventilators right now. Our members at Therapeutic Bedding in Pennsylvania switched from making mattresses to medical masks. There's other locals like USW 3298 in District 4 and Local 9-0425 in District 9 who have donated N95 masks and surgical gloves to help with PPE shortages in their communities' healthcare facilities. So, we've got these locals all over the country that are doing these good things. They're out raising money to donate to local schools who are still providing lunch to students. USW Local 14241 teamed up with a local business in their community and purchased 2 3D printers to print and supply free PPE face shields to COVID frontline workers during the crisis. And there's many more stories of our members stepping up. But we wanted to take a quick second here. Our union's new media team has put together this great video to tell a story of USW Local 366 in Maine. They actually converted their entire business over to make masks for frontline workers. So take a moment with us and check out their story.
American Roots is a manufacturer of 100% American-made and union-made clothing down to every thread. We're the only company in the country that takes raw materials, 100% sourced in the U.S., and then manufactures them in our proudly represented USW Local 366 factory here in Westbrook, Maine. That all came to a screeching halt We laid off 80% of the workforce. I said, who would be willing to come back to work if we were going to produce PPE products in the next couple of weeks? I need a show of hands. Every single hand went up. And we knew that our machines could manufacture masks, certain types of gowns, certain types of booties. We had no idea that we could play a role with face shields until Flowfold came to us. And so we're moving forward with gown and mask prototypes, which will come out this week. And we'll begin to send those prototypes out to healthcare providers, unions, CDCs, FEMA departments. I needed help putting up plastic walls, essentially. And so I called my neighbor. He happens to be a IATSE member. He's like, I'm in, I'll help you. Saturday morning, I came in at around 7, and 8 of the bravest, most thoughtful, humbling people I've ever met, who have lost all their jobs and have no work, volunteered their time so that people they've never met before, that are from a different union, different industry, could have the opportunity to help other brothers and sisters who are on the front line with protective face wear. If that's not what the labor movement's all about, I don't know what is. It's insane to me that we live in the richest country in the world with more resources and more technology. We can print money and we're getting our ass kicked. I understand crisis, but for us to be as unprepared as we are, I hope that this is a wake-up call, that we can no longer rely on cheap labor and cheap products from overseas to save a buck so that shareholders make more money.
Now, that's a really good story. It's really clear that, really through solidarity actions, how we'll get through this. And then we'll start looking at basically a longer term economic recovery. Our union is already, has a long list on infrastructure priorities and other priorities like pensions, current pay, all of these things. And we'll do everything we can to kind of get the economy going once these state orders are over. And really, hopefully we can, this is one of the best parts about being in the union, is seeing this community of people come together.
Yeah, that's right. Roy, our members just do amazing things every day. And, I feel the same way as you guys do. We couldn't be prouder of them. So kind of before we go offline here, Connie, do you have a couple of other questions that maybe we can answer before we finish up?
Yeah, I want to thank everyone for joining the live feed. This has been really great. Thanks to you all for your answers. I know we had a lot of questions and it may feel like we didn't get to all of them. I want to tell everyone that we will reach out to you offline if we did not answer your question live. A lot of them about specific situations or workplaces. We're going to have to get you in touch with your staff. So please check your Facebook Messenger and look for one of our new media team members to get in touch with you, to hook you up with your staff about those questions. And if you don't hear from us, remind us, and I promise you we'll get in touch. I also want to remind, there are lots of questions about things like bargaining and lessons learned. What are we going to do about this in the future? This is a great time to be active in your local. If you're not already, this is a good reminder that all of us are the union. And we have the power collectively through our local unions and through negotiations to push through some of these changes. So if you're not active in your local, please get active in your local and get others active, because we're definitely stronger together. And the last question that I want to raise has been asked by several folks. They want to know if they're on reduced hours, they're still working, but their hours have been cut. Are they eligible for any of the benefits in the CARES Act, including unemployment?
So the answer is yes, somewhat. So, you know, everyone is eligible for that $1,200 stimulus payment that Roy talked about. So that should be going out to anyone who filed a tax return or who received Social Security. The unemployment question is, I'll just say it depends. You know, if you've had a substantial reduction in hours, you may be eligible for some unemployment. You know, I know that, just speaking personally, that's something that happened to someone in my family and they were eligible, but that might not be the case for anyone, just depending on how big the reduction was.
Thanks, Anna. Again, reminder, if we didn't get to your question specifically, we'll be in touch.
Thanks, Connie. So Anna and Roy, you know, we want to thank you both for taking the time out to break these bills down for us. They can really be complicated. We know it's not always, you know, it's always good to step back and take a moment to try to understand what all these things mean. So thanks again to both of you and your teams in DC for all you do to move the legislative priorities of our union forward. It's appreciated.
Thanks, Amber, and thanks everyone for tuning in. We hope that this was helpful, and we just have to say a big thank you to the rest of our team here in DC who are really working hard.
Yeah, no, it's a really crazy and amazing experience to try and be here for the membership. And you know, it's you know, when we look back, you know, a decade ago I was a laid off worker in a paper mill, and now having to do everything we can to keep workers safe, and then B, to do everything we can to you know, ensure workers are properly protected for those that have to work too. So we'll get through this. The best thing we can do is work together collectively and bargain for the best position we can.
Yeah. Thanks, guys.
Everyone.
You know, for everybody else, we also want to let you know that there's some resources that are available to you in your locals. As always, if it's a question that involves your immediate workplace and a collective bargaining agreement, please first reach out to your staff representative for help. You, again, like Connie mentioned before, you can find the information on our website under the district tab. The district directors and all of our staff are working tirelessly right now to do everything they can on the ground to help our members and really find the best solutions that we can right now. If it's a broader issue regarding the crisis, the USW, who again has this great resource page, which has lots of helpful links. There's guides for members who are still working. There's resources for veterans. There's community resources and a lot more. And they're working very hard to keep that updated. So we know this is a really, you know, unprecedented time for all of us, and no one really has all the answers right now. But just please know that your union, you know, is continuing to work hard to try and find those answers, and we're going to keep doing that. Please also reach out to our district rapid response coordinators for information on the program. We know that we need to continue to push those we elect, regardless of which party they belong to represent us and keep the priorities of working people, you know, up front and center. And, you know, we need all of our voices to do that. And that's what our program is all about, is engaging all of our members to help. You can find the contact information for them on our webpage, uswrr.org. So thanks for being with us this evening. You know, we hope this has been helpful to all of you. Again, this is tough. We don't know all the answers, but please know we're working hard to find them. We know we're stronger when we all stand together. So thank you again for all that you do every day, and please stay safe, Steelworkers.